This presentation was created by Dr. Dave Ferrulo, a licensed independent clinical social worker and master licensed alcohol and drug counselor in New Hampshire. In this video, we will overview the ethical considerations surrounding dual relationships in psychotherapy, grounded in the National Association of Social Workers Code of Ethics and the New Hampshire Office of Professional Licensure and Certification. This is crucial for maintaining the highest standards of professionalism and ensuring the well-being of our clients. The definition of dual relationships. Dual relationships in psychotherapy occur when a therapist has a secondary relationship with a client outside of the therapeutic context. These relationships can be social, financial, or personal and can potentially compromise the objectivity and effectiveness of the therapeutic relationship. The NASW Code of Ethics sections related to dual relationships. 1.06 Conflicts of Interest. A. Social workers should be alert to and avoid conflicts of interest that interfere with the exercise of professional discretion and impartial judgment. Social workers should inform clients when a real or potential conflict of interest arises and take reasonable steps to resolve the issue in a manner that makes the client's interests primary and protects clients' interests to the greatest extent possible. In some cases, protecting clients' interests may require termination of the professional relationship with proper referral of the client. C. Social workers should not engage in dual or multiple relationships with clients or former clients in which there is a risk of exploitation or potential harm to the client. In instances when dual or multiple relationships are unavoidable, social workers should take steps to protect clients and are responsible for setting clear, appropriate, and culturally sensitive boundaries. Dual or multiple relationships occur when social workers relate to clients in more than one relationship, whether professional, social, or business. Dual or multiple relationships can occur simultaneously or consecutively. D. When social workers provide services to two or more people who have a relationship with each other, for example, couples or family members, social workers should clarify with all parties which individuals will be considered clients and the nature of social workers' professional obligations to the various individuals who are receiving services. Social workers who anticipate a conflict of interest among the individuals receiving services or who anticipate having to perform in potentially conflicting roles. For example, when a social worker is asked to testify in a child custody dispute or divorce proceedings involving clients, should clarify their role with the parties involved and take appropriate action to minimize any conflict of interest. NHOPLC rules. The NHOPLC enforces stringent regulations regarding dual relationships, MHP 501.03. This rule prohibits engaging in dual relationships that could impair a therapist's professional judgment and objectivity. MHP 502.02. Therapists must disclose and manage any potential conflicts of interest arising from dual relationships, ensuring transparency and safeguarding client interests. Ethical dilemmas and scenarios. Dual relationships can present several ethical challenges, including friendships. Developing a personal friendship with a client can blur professional boundaries and affect therapeutic effectiveness. Engaging in romantic relationships with clients is a severe ethical violation that can lead to significant emotional and psychological harm. In small communities, therapists may encounter clients in social settings, which involves third-party involvement. Managing these inadvertent encounters requires careful boundary maintenance to avoid ethical breaches. Best practices. To avoid and manage dual relationships, the following best practices should be adhered to. Establish clear boundaries. From the outset, set and communicate clear professional boundaries with clients. Regular self-reflection. Continuously reflect on your interactions with clients to ensure they remain within professional limits. Seek supervision. When in doubt, seek supervision or consult with colleagues to gain perspective and advice on managing potential dual relationships. The consequences of ethical violations. Violating dual relationship boundaries can lead to severe consequences, including sanctions and fines. Therapists may face professional sanctions and substantial fines. Loss of license. Engaging in unethical dual relationships can result in the revocation of one's professional license. Civil suit. Clients harmed by dual relationships may pursue legal action, leading to significant legal and financial repercussions. Incarceration. In some cases, such as the recent incident involving a psychotherapist in Rochester, Minnesota, engaging in a sexual relationship with a client can result in criminal charges and imprisonment. Let's overview a few case outcomes. Case 1. A mental health counselor from Lake Orion, Michigan was sentenced to 1 month in jail and 18 months of probation for engaging in a sexual relationship with a former client. The 40-year-old therapist pleaded guilty to fourth-degree criminal sexual conduct. The relationship, which began shortly after their professional interactions ended, was deemed an abuse of her authority as the client, a former military member, was particularly vulnerable. The counselor agreed to surrender her counseling license as part of the plea deal. Case 2. In Colorado, a trauma therapist from Durango surrendered her license following complaints about having a dual relationship with a client. The therapist admitted maintaining a platonic dual relationship with the patient, violating state standards. She relinquished her license without admitting to the allegations. This incident has raised concerns among peers about ethical practices within the local therapy community. Case 3. An experienced therapist from Rochester, Minnesota, was sentenced to 4 years in prison for having a sexual relationship with a patient. She pleaded guilty to third-degree criminal sexual conduct. The investigation began after the Minnesota Adult Abuse Reporting Center filed a report. Evidence included various explicit photos and messages that were to the victim. As part of her plea deal, she will also serve 10 years of conditional release after completing her prison sentence. Conclusion. It is imperative to remain vigilant and adhere strictly to the ethical guidelines and regulations governing our profession. By maintaining clear boundaries and prioritizing the well-being of our clients, we uphold the integrity of our practice and foster a safe therapeutic environment. For further information, please refer to the NASW Code of Ethics and the NHOPLC rules. Should you have any questions or need further clarification, seek supervision or peer collaboration.